Good morning, this is Dr. Timothy Scott back here at Life Point Medical. It is Wednesday, January the 27th of 2021, and I want to say good morning to you and let you know that I just got my second COVID-19 vaccination from the health department, and I'm doing fine, hadn't had any adverse reactions to it, and I still get asked daily about the COVID vaccine, and I tell everybody the same thing. I do think the benefits outweigh the risk when it comes to the vaccination versus the COVID-19 virus itself. The problem is I've seen a lot of people with some complications related to the COVID. In other words, they lived through it and they did okay, but they still got some issues that are lingering. And I don't know how much of an impact this is going to have on the rest of their life or how long it's going to take to get better and things like that. So with all that in mind, I've not seen a huge amount of people having bad reactions to the COVID-19 vaccination. Now, I do hear some stories of it, okay, but they've given out millions and millions of these vaccinations, so I think if there was something really going crazy wrong with them, we would know about it. As far as COVID-19 goes, there's 1,318 reported this morning, which is up 8 from yesterday. I was talking to the ladies at the health department, and I think they get the sense that everybody's kind of letting their guard down when it comes to the vaccine, but I want to encourage us to continue to try to hold our line with that, okay? Wearing your mask, using your alcohol, hand sanitizer, social distancing, things like that. It is important that we continue to monitor that. I will tell you that I'm at somewhat of an advantage when it comes to this because I've been dodging infections for many years just because of the nature of my work. So I have routines set in to try to minimize my disease or my disease prospects. And I think that's real important if you work in a doctor's office to have routines set up so that you can avoid catching everything. And I don't think I get a lot of stuff from my office. I know I get a lot of stuff from my children, okay, but I don't think I get a lot of infection or contagion from the patients I see in here in the office because, like, every door has an alcohol dispenser beside it, and when I walk in or out of a door, I use that alcohol dispenser. Plus, it puts a film on your hands that tastes like yucky, so if you stick your hands in your mouth, it deters you from doing that. Okay. Real quick thing about services here. I want to remind everybody that we got our women's wellness clinic back there that's staffed by Monique, my nurse practitioner. I have been diverting only our annual wellness visits back to her, mainly because those can be done by somebody besides me. It also allows the women, if they need the total care, if they need an exam specific to women, pap smear and things like that, they can go ahead and get that done right then, as opposed to having to go back over there and do that. So I'm letting her do the annual wellness visits for the women. And if you need the pap smear, if you need the rest of your exam done that we don't do over here, she can go ahead and knock that out. Plus, I'm here in the building, so if there's any complications or any issues, I'm readily available to her to get those taken care of. Okay, and then we take care of the rest of the stuff over here on the internal medicine side. Okay, so use our women's wellness clinic. The number 706-782-5555. We've got our hormone therapy over there. Also, we've got Botox that she's doing. She's doing the annual wellness visits, plus she's doing all the birth control and different things that women might need specifically. Last but not least, Place of Hope, North Georgia is a darn good idea for this community, and I'm a big supporter of it. I'm a trustee in the organization. If you feel like in your heart that you can provide monetary support for this organization, Place of Hope, North Georgia, P.O. Box 933, Clayton, Georgia 30525. Otherwise, if you get sick or you think you're getting sick or you want to ask me or tell me you're getting sick or you want me to examine you or anything like that, we're here for you. We want to hear from you and get you set up with an appointment if you've got something going on that needs our help. Have a great day.